Picture a beautiful warm day outside. You're taking a nice, peaceful jog outside in the park. Everything seems perfect, the sun is shining, and the birds are singing. Nothing can go wrong. Until it hits. The agonizing, throbbing, pulsating pain of a migraine. Those beautiful sounds of the winds and the birds flying through the sky have now become the trigger. A beautiful sunny day gone dark in the matter of seconds. But what if there was a solution? Something that could help alleviate the discomfort and pain of your migraine? Well, there is. And believe it or not, it's Botox. But before we get into what it is and how it works, as a quick disclaimer, Botox is not a cure for migraines. It is a treatment option that focuses on relieving symptoms and preventing additional attacks. So what is Botox? Well, it's actually a drug made from a toxin produced by the bacterium Clostridium botulinum. It's the same toxin that causes a life-threatening type of food poisoning called botulism. Typically, doctors use it in small doses to treat health problems, such as the temporary smoothing of facial wrinkles and improving your appearance. It's also been used to treat severe underarm sweating, cervical dystonia, an overactive bladder, strabismus, and more recently, for chronic migraines. The way Botox injections work are through weakening or paralyzing certain muscles or by blocking certain nerves. The effects can last from 3 to 12 months, depending on what you are treating. So now that we've learned a bit of background information on what Botox is and how it works, let's learn a bit more about migraines and what differentiates them from the common headache. Migraines are a recurring type of headache. They can cause moderate to severe pain that is debilitating, throbbing, or pulsing, but it's often on one side of your head. There are other symptoms associated with it, such as nausea, weakness, and even sensitivity to light and sound. But we still don't know exactly what causes them, but researchers do believe that migraines have a genetic cause. However, there are a variety of factors that can trigger a migraine, which range from person to person, some of which including stress, anxiety, hormonal changes, too much or not enough sleep, meal skipping, tobacco, and even caffeine or caffeine withdrawal. It's also been found that there are certain foods that can trigger migraines, such as alcohol, chocolate, some fruits and nuts, yeast, fermented goods, and even cured or processed meats, amongst many others. But who's at risk for migraines? Well, based on the 2010 and 2011 Canadian Community Health Surveys and the 2011 Survey of Living with Neurological Conditions in Canada, it was found that an estimated 8.3% of Canadians, which is approximately 2.7 million people, reported that they have been diagnosed with migraines, with females being more likely than males to report having a migraine. Migraine prevalence was highest among people in their 30s and 40s and ranged from province to province. Other medical conditions such as depression, anxiety, bipolar disorder, sleep disorders, and epilepsy have also been found to put an individual at higher risk to be diagnosed with migraines. So how can Botox be used as a preventative treatment for migraines? What makes you eligible? The way it works is the Botox will be injected using a microneedle to the areas involved in headache and migraine pain. It affects the nerve endings by blocking the release of chemicals involved in pain transmission. By examining a meta-analysis of using Botox versus a placebo for the treatment of migraines, it was found that across 17 studies, including a total of 3,646 patients, that the injections were superior to the placebo for chronic migraines after 3 months of therapy. For the first time, a real benefit in patient quality of life was demonstrated. But what makes you eligible to receive the Botox injections? Well, just because you've been diagnosed with migraines does not automatically mean you're eligible. In order to be able to receive the treatment, you would have to be diagnosed by your physician with chronic migraines. This is the most severe form of a migraine, affecting only 1 to 2% of the population. These people would have had more than 15 days of headaches a month for at least 3 months, 8 or more of which are migraines. Okay, so now that we've learned about what Botox is, how migraines differ from headaches, and how Botox can be used as a preventative treatment for chronic migraines, let's do a quick wrap-up. While Botox injections do have promising effects, it's important to note some potential risks and side effects associated with it. These include, but are not limited to, pain, swelling, or bruising at the injection site. You could also have flu-like symptoms, a headache, or even an upset stomach. However, there are still other risks that are currently unknown and still need to be studied more. But a final disclaimer. If you are pregnant or breastfeeding, you should not use Botox. Always consult with your doctor beforehand and ask for advice to verify your potential eligibility. And any Botox injections must be administered by a registered healthcare professional. Lastly, remember, there is no cure for migraines. This treatment only focuses on relieving symptoms and preventing additional attacks. More research and studies still need to be conducted to find a definitive cure to treat migraines.